virtually any kind of type of ache or pain, so to speak, can respond well to non-operative treatment. And again, because we work so closely with our surgical colleagues, unless something is a complete tear of an important ligament or a complete tear of an important structure, almost always we'll start initially with conservative treatment that may involve some time in a brace or a cast, some time spent in rehab, allowing the body to heal. Other times we may use other products to stimulate healing in the body via regenerative medicine and other modalities like that before we get to surgery. And the majority of the time, we may not even need to proceed with surgery unless it, like I said, it's clear cut, like a sudden injury, say for an ACL injury in the knee, for example. If there's a complete tear in a young person, that's very clear cut that that's surgery, and we get them promptly into our surgical colleagues to address that. Depends on what type of joint it is. If it's a weight-bearing joint like in a knee or hip versus something else. In general, we talk about fitness, and depending on what the person is doing activity-wise, either in their hobbies or in their work, we want to work on fitness. Keeping muscles strong around a joint can help offload it and ease pain. If someone has excess weight, taking off even just a little bit of weight can really add up to a lot of pressure off the joints, and keying in on appropriate exercises can really help that. And then again, short of surgery, there's injection options, sometimes some supplement options that can go a long way and really help a patient do very well from a non-surgical means. Patients will also often come in asking, should I put ice on this? Should I put heat on this? And in general, we'll let people know that it's not magic and going to make things a lot better. That being said, it doesn't necessarily hurt, and so I'll frequently tell patients the proof's in the pudding. And you can do alternating ice and heat. We generally tell people to heat or warm up a given area in the body prior to exercise or movement. Once they're done with activity or say done with work, then go ahead and put ice on it after that. So we kind of will use them in conjunction and combination, but generally starting activity with a warmed up body and a warmed up joint, and then finishing with ice to help it kind of cool down and recover.